I think a lot of us kind of forget that, our vision really can impact what kind of mood that we're in. If we're used to seeing and then we don't, kind of make you in a bad mood in some
And it
ways.
makes everything harder.
Yeah, exactly.
Today, we're going to talk to Regina Budet of Empower Occupational Therapy. Thank you so much for being with us today.
Thank you for having me today.
As we get older, often our vision does decrease, or we have other challenges that come into play. What are the things that we get to a point where sometimes it can't be corrected anymore, and what do we do about it?
Right. So, yeah, that's exactly what low vision is. So, it's that vision or lack of vision that can't be corrected by glasses or by surgery when we're still having some difficulty. And those are the things that you might notice, like it's harder to read the newspaper, it's harder to write checks or pay your bills. And that's really a sign that we need more than just your routine eye care, and we might need some therapy.
What typically causes low vision?
Most cases are from their age-related conditions like macular degeneration, glaucoma, diabetic retinopathy. It just we have normal eye-related changes as well, which makes it a little bit more difficult. Our eyes don't process the light that comes in as well. We just need more light. So those are the main causes of visual impairment, and if there's any kind of trauma to the head or to the eye, that can also cause difficulties as well.
When you hear the term low vision therapy, maybe you're envisioning eye exercises or something. Tell us what low vision therapy actually is.
Yeah, it can be very confusing because there is vision therapy, but what we do for low vision rehabilitation is we maximize how you're able to use your functional vision that you have left. So you are more satisfied with how you're able to use that vision, and that can be through different types of compensatory strategies, or maybe we're using devices like magnifiers or specialized glasses to help with that.
When you go to an eye doctor as you get older, do you sometimes have doctors that might just say, well, you're just getting old, your eyes are getting old, you're just not gonna be able to see as well? And do you have to really sort of advocate for yourself that you might need some additional assistance?
Yeah, absolutely. I would hope they don't say that, but that wouldn't surprise me, unfortunately. I think some doctors just don't know that there are low vision providers available in the area. It is a very specialized area of practice. So, really being able to get to that specialist, there are different retinal specialists that can help. But really, even with the low vision specialty, being able to get connected to them. So yes, I would just ask the doctor, what do you know about low vision? And they may not know very much, but you can get more information from them. And they may say you don't need this for a while, because some physicians think of it as a last resort, and it really should be something that we're doing more of an earlier intervention to really, maximize what we have.
Mhm.
So I would definitely advocate for that, and it may take multiple attempts, but with the client that has the macular or the vision condition, family members, everybody involved, really advocating would be great.
So you mentioned that some of the signs might be not being able to read the newspaper well. What are other things that we should be maybe noticing in our parents that that might indicate, hey, mom or dad, have you thought about that? We might can get some help with this, because I would imagine if you see them, maybe they used to be avid readers and they're not reading anymore because it's just too hard. So what are some of the things that you would look for, and maybe how would you broach the conversation with your parent?
Yeah, the reading is usually one that I think they're pretty vocal about, that's something different that's hard to do. Like reading a menu gets to be more and more challenging, reading the mail. And that's usually something people enjoy doing, is reading reading the mail. Other things that you might notice are difficulties with just navigating in their environments. They start walking a lot slower. They're much more guarded. They start kind of hugging the wall. Difficulty with steps, just like starting to get real hesitant with that. So just kind of asking more questions like, why, is there something about the stairs that is challenging for you, to get a little bit more information about that. But yeah, just kind of asking questions and very specific questions, because it can change, throughout the day. The morning might be better, the vision's better. You may not be noticing as many things, and then by the end of the day, it's different or in different lighting conditions. So it's not always the same behavior all the time. So it's good to ask a lot of questions.
I think that's where it ties into where your vision can actually really affect your demeanor, your personality, your attitude, if you're in a good mood or not. My mom, her vision isn't great, and she's been in memory care for almost 2 years. And when my dad goes to visit her, he used to take little 4x6 pictures of the family just to show her, kind of remind her, like, yeah, here are the kids, here are the grandkids. And she would get kind of grumpy about it. Who is that? I can't see who that is. And he finally started taking big 8x10 pictures, and now she can see them better. And it puts her in a better mood when he visits.
Yeah, it's definitely starts restricting how we're interacting in our environment. We start to withdraw a little bit more when we're not able to engage. And a lot of times, too, just with age, our hearing also declines. So then we've got more of a dual sensory problem where we can't hear or see as well. And that's just really limits how we're able to interact with the people around us. So yeah, and then people just kind of sit there and not really engage or try to initiate conversation.
Right. So what is if somebody's going through low vision therapy, what does that look like?
So we started off with an evaluation. Usually they will have seen a specialist that has identified that they have a need for low vision. So we'll do an evaluation, and that really lets us know what their goals are, what's important to them, because everybody's different. Even, two people with very similar visual acuities and similar condition, it's very different because they want to do different things. They have different supports. Different abilities. So really knowing what's important to them and what they want to do. And then from there, that's when we start to determine like what strategies we want to use and how we want to address those things. But it's definitely very interactive. So whatever the client really wants to be able to do is that kind of dictates where we're going to go.
So just even when maybe your parent is you feel like they're maybe going down this road, in the meantime, what are some things that they could use that could help them, compensate, if you will? Because I think that what you're saying is that we're trying to we can't necessarily make the vision better like we can with glasses or contacts, but it's just how do we best use the vision that we have left?
Yeah. So there's definitely magnification options. Things like audiobooks even have become so much more popular than they used to be. And I think they're just more accessible. So people are less hesitant to use it because everybody's using it, regardless if you can read or not. So that doesn't make you look any different by using an audiobook. So if they're really avid readers and maybe it's just difficult for them to read, we can use things like audiobooks or large print or adding lighting. Usually the better the task lighting is on the page will definitely help more so than overhead lighting.
Okay, so a few little tips.
Those will definitely help quite a bit. Bringing things closer, it's a different type of magnification. We don't think about that as a magnification, but bringing things closer is one thing that we just kind of do naturally. Those kinds of things. Also, if reading, just because reading is one of those things I always hear about. If reading gets to be very tiring, just remembering to take breaks. So you may not read for hours at a time, but just read for like little short bursts, and that'll help your vision to be less tiring throughout the day.
Yeah.
And is there anything that we as the adult children should do if the eye doctor says, LASIK, of course, won't work, and they don't need cataract surgery, or that won't work? How do we instigate or bring about finding low vision therapy?
Yeah, so I would ask if they know of any low vision specialists, occupational therapists. Again, we're pretty, there's a small selection of us, so we're kind of spread out. But just asking, like, do you know who these people are? And then just, being in different groups. Facebook groups are great for just being able to ask other people, what are you doing to manage your condition? And friends and family that may have been, having similar experiences, kind of asking what they've done. But those are some great ways to get some resources.
Yeah. Okay.
Great tips, Regina. Thank you so much for all the information.
Thank you so much.
Good to know that there are options and ways that you can help your aging parent if they are having trouble, and glasses or contacts aren't going to work or aren't going to solve the problem anymore.
Yeah, it really is, because we know from experience with my mom that it can help. Hey, if you have any other topics that you'd like us to discuss with an expert, please let us know. Parenting aging parents.